say you watched it on?
We would be talking about, for now, according to RHI Hub, Rural Health Information Hub, as our resource. Healthcare access in rural community is access to healthcare services is critical to good health, yet rural residents face variables of access barriers. A 1993 National Academies report, Access to Healthcare in America, defined access as, quote, as it relates to healthcare, timely use of personal health services so as to achieve best possible health outcomes on the part of the patients or the person needing healthcare services, unquote. 2014 RUPRI Health Panel report on rural healthcare access that encapsulates additional definitions of access with examples of measures utilized as determinant access with healthcare access. Ideally, residents ought to be able to conveniently and confidently access services such as primary care, dental care, behavioral health, emergency care, and public health services. Access to health care is important for one, overall physical, social, emotional, mental, spiritual, environmental, and so on status. Second, prevention of diseases. Third, the detection, diagnosis, and care and treatment of ailments. Number four, it determines quality of life of individuals. Next is avoiding those that are preventable causes of death. And finally, life expectancy. Rural residents often encounter barriers to healthcare, limiting ability in obtaining care they need. Access to healthcare implies healthcare services are available and obtainable in timely manner, even when adequate supply of healthcare services exists in community. There are other elements impeding healthcare access, particularly in the context of rural domain. For instance, to have healthcare access, rural residents must likewise have, first is financial means to pay for services such as health or dental insurance, acceptability by healthcare provider. What's this? Not free with rural areas. Next, means to reach and use services such as transportation to services located at distance and ability to take paid time off of work so as to use services. That's our question. not free health care services in rural areas. Next, confidence and ability to communicate with healthcare providers, specifically if patient is not fluent in English or limited health literacy. Next, trust, used for services without compromising right to privacy. And finally, confidence that they will achieve quality health care. This guide provides overview of healthcare access in rural America, including vitality and benefits of access to healthcare, including barriers rural residents experience. Guidelines include information regarding first, barriers to care, including workforce shortages, health insurance status, transportation issues, health literacy, and stigma in rural communities. Next point is access issues for specific populace and health services. Finally, strategizing resources so as to uh, improve the delivery of necessary health uh, content. How are private foundations working to improve healthcare access and related reimbursement issues? Various private foundations work to improve healthcare access by funding transportation services, improving workforce, addressing elements affecting rural countryside healthcare access, investing in existing safety net providers and programs, granting, develop, and implement innovative healthcare delivery models, and funding research to study policy implications as they relate with rural healthcare access are all instances of actions foundations taking to support rural healthcare access. As to what can be done to help rural veterans, uh, people in general, access healthcare, one of primary barriers rural folks face when access to healthcare services is in question is significance significant travel distance to nearest populous affairs, VA, oh no, healthcare facilities. A 2018 study found uh, rural people's access to healthcare is not necessarily issue of eligibility for purchased care from the patient's non-patients providers, as most patients healthcare facility districts also have shortages of non-patients providers. The 2024 U.S. Senate Committee on People's Affairs, as it relates to healthcare adherence, frontiers on healthcare, ensuring their access, no matter where they live, discusses issues related to rural people's healthcare access, such as staffing, facilities, broadband, distance to healthcare providers, and so on. The substance use disorder services, despite growing need, there is a shortage of substance use disorder services offered in many countryside communities across America. Medically managed withdrawal is initial step of uh, substance use disorder treatment involving managing acute intoxication on the part of the citizenry and withdrawal, as well as minimizing medical complications. Lack of withdrawal management providers in many countryside areas creates barrier to care, resulting in patients foregoing or delaying needed treatment. In lieu of withdrawal management provider in countryside community, local emergency uh, room or a county jail, although not most appropriate location for withdrawal management services, must often serve as substitute. 2024 article, Rural Urban Differences in Out-of-Network Treatment Initiation and Engagement Rates for Substance Use Disorders, reports similar issues, showing there are lower rates of substance use treatment initiation and engagement in rural areas compared to urban areas. Correct. What's with this? Oral oral health services affecting overall physical and emotional health. For example, the needs needs that are not addressed, leading to pain or cosmetic concerns, affecting academic or professional success. Despite the importance of oral care, access to dental care is either very limited or difficult to access in many rural and remote communities. Traditionally, health insurance plans have not covered oral health services. Separate dental insurance plan is needed so as to cover oral health services and procedures according to 2021 National Institutes of Health for Oral Health in America. Fewer rural residents have dental insurance compared to urban residents. My attention is being called with Babalos.